It's Rachel. So I'm gonna do, I think this is update 4 on what's going on in the emergency room. I usually do these on Friday or Saturday at 10, but I've been on nights this whole week. So I am going to do this a little early. Hopefully you guys will get a chance to see this. As always, I don't really get a good chance of reading the comments as we go along. So if you have a list of questions that people asked in my previous video, when I get a chance, I'll try to remember to link that either down below or above if you guys have any questions and want to look through that video. But anyway, so updates on where we are with coronavirus or COVID-19, which is the disease that has kind of rocked the world recently. So we are definitely flattening the curve, at least here in San Antonio, and the news from around the US is although grim, looking a little bit better. I have friends that work in New York, and they're saying that they're starting to see a little bit of a break in the numbers, which is good. I mean, the death tolls are very high still, but we're going the right direction. So that is good news. Does that mean we should let our guard down yet? No, not really. And this has been a hard one for me. On one hand, I really am very happy where we're going with this and how things are going. But on the other hand, I'm incredibly frustrated with people in general on how they're dealing with this. So what I mean by that is with lockdown. I think the biggest question everyone's going to ask is, should we stay on lockdown? Should we continue to socially isolate? And yes and no. So yes, we need to continue socially isolating. You should not go visit friends and family. We need to continue wearing face masks out in public. But we can't stay locked down forever. And I want to talk about flattening the curve, what that truly means, because I think a lot of people misunderstand it and are getting very upset about the idea that we are going to come out of lockdown, and we have to eventually. What flattening the curve is not to prevent people from getting the disease, believe it or not. If you look at it, the original curve was really sharp and fast, and the idea was to flatten and spread it out over time so we don't overwhelm the healthcare system. The reason that idea was there is so that we don't have extra deaths because the healthcare system basically collapses. We have done a pretty good job, at least here in Texas, of flattening that curve, meaning we're not seeing that exponential, super high peak of cases coming in. And in fact, our hospitals are fairly empty right now. My volumes in my ER are down 50%, and that's kind of around, except for places like New York and maybe parts of California, that's kind of the norm right now, where volumes are really down. We are not overwhelming the hospitals right now. And so we are doing the right thing. That means we do need to start slowly opening things up, very slowly. So things like elective surgeries. The reason we need to do that is our hospitals are hemorrhaging money. They're furloughing our nursing staff. And there are some rural hospitals that are at risk of shutting down completely. So we are at that point where shutting it down too much is actually harming the very structure that we're trying to save. People are still going to get this disease no matter what we do. Whether we stay locked down or not, everybody's eventually going to get some form of this disease, or a big chunk of the society is. But we're now at a point, we've not overwhelmed the hospitals, that we can start slowly putting up maybe elective surgeries, a few businesses, but we still should maintain isolation, i.e. you shouldn't go and hang out with family members. We shouldn't still have big gatherings. At least in my area, we've continued to keep schools closed down. And although that is painful as a parent having to homeschool, that's still very good. And so, yes. Now, from a standpoint of what I'm seeing, people are not following social isolation, even when we're in full lockdown. I've had patients come in that they think it's okay to hang around with their family members. The social isolation and staying home means you don't go interact with Uncle Bob, who lives in a different city, for a birthday party. You only interact with the family you live with, period. I had a gentleman that was interacting with a hospital staff member who was a friend, then went to another city and went to a birthday party while the whole state's in lockdown. And then while he had fevers, and then came to our hospital a couple days later, he had COVID-19. His daughter, who now has symptoms, has COVID-19. He infected a whole bunch of people. But he didn't think about it being a big deal because, oh, it's just visiting family. So please, even if they start lifting restrictions, which they're going to need to do, please be mindful of that. On one hand, it's like I want restrictions up. On the other hand, people need to be smart. They just need to be smart. All right, so I'm going to get into the questions here and talk a little bit about some of the stuff. And thank you guys for commenting. Again, I read those comments, and hopefully we'll get back with you guys. It's been kind of a crazy week. This is 5. So tonight is my 5th shift in a row. I will have worked 48 hours total in those 5 days, and I'm really tired. It's been hit or miss on how many patients I'm seeing. Some days I haven't seen anybody that has potential coronavirus, and then some days I have seen multiple cases. But just that whole anxiety of will they come in or not is frustrating. I am seeing a lot of people that have put off coming to the ER for very serious illnesses finally coming in. I mean, people that really should have seen us weeks ago that are near death, and that is terrifying to me, of how many people are sitting at home getting very ill when they need to be coming to the ER. Be okay with the idea that if you have something serious going on, your ERs are trying to isolate it away from the other part of the population. So don't put off going to the hospital if you think you're having a heart attack, or if you're having a bleed from your rectum, or you are really, really sick. Please don't, because I'm seeing really bad debilitating disease on people that waited far too long because they were afraid to come to the hospital. And we're going to end up getting more deaths because of that. All right, so going into some of the questions. Someone asked me on my previous video about immune systems, how we can help booster our immune system to help prevent against getting this disease. Well, it's just the same with anything. Plenty of sleep, plenty of hydration. Zinc is not going to hurt you. I don't know, the studies are kind of iffy on if it helps you, but it's not a bad thing. So your good multivitamin a day, your healthy dose of vitamin D, either going out in the sun or getting it in your food, or a vitamin supplementation. That's really important. Exercise is good, but don't overdo it if you're not a hardcore person that works out. It's not about the absolute heart rate. It's about getting good, healthy exercise in daily. Okay, so I talked a little bit in my last video about virus and antibody testing, and one of the things we would need to help open up our society. And there was someone that had some really good questions about it. So when I talk about antibody testing, I'm talking about looking for things like IgG and IgM. So you're looking at these things, and one tells you if you're in the acute phase of the disease, and one tells you if you're in the later phase of the disease. And this is like in depth from my immunology days, but if I remember correctly, IgG is the more acute phase and IgM is the more later phase. What we need is an antibody test that will tell us both. Right now, the antibody tests that you're seeing a lot of people come out in that are not FDA approved are kind of a little questionable. Some of their sensitivities are off, and they're cross-reacting to just your common coronavirus, not COVID-19. So those tests are a little concerning. What we're looking for is, what I mean is, I want to see people who actually have the immunity, like they've gotten the disease and they're over it. Now, we don't know, does that mean that they are fully protected? But we just don't have that answer. But right now, we don't have anything that suggests that if you have the antibodies, you won't be protected. Now, someone brought up the fact that, and I'm reading on here, that the antibody test does not check for viral load. Yes, that is absolutely correct. A viral load is a totally different thing. The test you see people getting swabbed for, that is actually a PCR test that looks for little chunks of RNA that matches up with the virus, and that's how they detect the virus. That also doesn't tell viral load. Antibody testing is more to see who has had it and gotten over it. And why that is important is if you have a large chunk of the population that never got the disease or never had the symptoms, but they now have the antibodies, that tells you that, one, a lot more of the population is protected, and two, the actual severity of this disease is maybe a little bit less, that its prevalence is much higher, and that maybe the death rate is a little bit lower. So that is a very important thing. And the prelim studies where they've looked, I think there was one coming out of either Greenland or Iceland, where it was actually a pretty high percentage of people that never had symptoms that tested antibody positive later. And so it's kind of scary, because you could have people that don't have any symptoms walking around who are spreading this disease. And we know that's happening, and that's making it more difficult to deal with and prevent this disease from spreading. That all plays into face masks and socially isolating. Most places now are kind of asking people to wear face masks. I know in my city now it is required. And I do think that is very, very important because that helps prevent the spread. Someone said, do they have any other tests because the swab to the nose is painful? Yes, they finally do. How good they are is questionable. There is now a finger one that, again, it's a little questionable how sensitive it is. Yes, the nasal swab is incredibly painful. They shove it basically back to the very back of your nose, and they swish it around for 10 seconds. Then they do it on the other side. Unfortunately, even that test is not that accurate. We had someone in our hospital that tested twice negative from that test and then finally tested positive. They've sampled different parts of the body, and they found that the highest concentration of the virus is in that back of the oral pharynx, or the very, very back of the nose, at least during most of the disease state. Later, it goes down into the chest, and then you need sputums, but they're not going to get sputum unless you're on a ventilator. Okay, so someone else asked, how do the antibody tests results look, and titers and all that? So basically, antibody tests have been used for most of the time. When we use them, it's to see if you are immune to something you've been vaccinated against. So they can look at, like, hepatitis B is one. I got the hepatitis B vaccine, and I had a bad reaction to it. And so I got it twice, and they titered me to see if I needed to get the third one or not. And my titers were super high. They have a range that they look to see how robust your immune system is. And that tells them, okay, your body is really reactionary to this, or it's not. So that's one example of it. They have titers for pretty much anything you can get vaccines for. Chicken pox. I had to get titers for chicken pox once, even though I had a documented case of shingles. The hospital required it of me. My titers were super high. So yes, that is what we mean by looking at that. Okay, someone asked about them being an essential worker in, I believe it was like a grocery store or something, and should they be scared? You guys are truly at the front lines, those that work out in, the essential jobs that are interacting with the daily public. Should you be scared? This person was young. No, but should you be cautious? Yes. You should wash your hands frequently. You should really wear a mask, and you should push with your company that they have a policy for social distancing, maybe putting some sort of screen to protect you from people, who have to get closer to you, or even a policy where people need to wear masks in your facility. I think everyone should be mindful and should be cautious, but should not be scared, okay? If you truly have health issues that make you at high risk, then you need to be extra careful and mindful, and obviously, but don't be scared. There's risk in everything. Just be smart, okay? And that's the big thing. Let's talk about plasma treatment. I talked about that a little bit and some other treatments that have been going on right now. There's been one big study that's finally come out about Plaquenil, or hydrochloroquine. It's not good, guys. That was all toted up in the media, and it's not promising. It's not showing any good effects. It has a lot of cardiac effects. In general, it's just not a great med. There are some studies still being done to look at prophylaxis, but you can't truly do an awesome study to look at prophylaxis because, you're not going to expose people to it unnecessarily. So it's all kind of like looking back and seeing if it might have worked. So plasma treatment basically is where they take people who are known positive, and they're not taking people that they might have been positive, known coronavirus positive, and then a certain titer level on their antibody test, and they're getting the plasma, and then they're putting it in people that are sick. We did that at one person in my hospital. It is showing very promising. It is a very good thing, and I am very, very hopeful that it will continue showing good promises. The other one, Redemavir, is also so far showing dramatic improvements. That's the Ebola medication that was developed. It's starting to loosen up for hospitals can get it. That is also very promising. And then the other one that one of my sister hospitals is doing that's showing a lot of promise is early ECMO. And not a lot of places have ECMO, but they're starting to not put people on the vent and put them on ECMO. ECMO is the heart-lung bypass machine that you see in folks that get heart surgery. And basically it bypasses the lungs and heart and oxygenates the blood for you. They're showing a lot of people do well. People can be on these machines and wide awake. So it decreases secondary infections and a bunch of other things, and people are doing very, very well. Why is this good, and why do we want to bypass the vent? For the longest time, the thought was this is more ARDS, or acute respiratory distress syndrome. The thought is shifting away from that. Some people still get ARDS, but the vast majority we're finding aren't, but they have these really weirdly low oxygen saturations. They have a viral pneumonia. There is some thought of dissociation of the oxygen hemoglobin curve, but we don't understand how that works. It's not actually binding to hemoglobin, but there's something finicky with how it's interacting with it. So what we are finding is if you put people on the vents too early, it is actually damaging their lungs, and putting them on too much pressure is causing more issues with the lungs. So unless you absolutely have to, support these people with oxygen outside of the ventilator as best you can, high flow nasal cannula, that kind of thing, but keep them off the ventilator until you absolutely have to. So that's a huge shift. That also means we don't need as many ventilators as we thought we were going to need. That's a big deal. Still need lots of oxygen, but not the ventilators. The other thing that we're finding we need more of is dialysis machines. These folks are getting a lot of kidney failure, like really high kidney failure. And that was something that wasn't really anticipated in the beginning. So I'm going to watch that and let you guys know further on that. So someone did ask about CO2 levels in this disease. I haven't been really hearing from my colleagues that the CO2 levels have been rising really high, like you see in people with COPD. So CO2 is that gas you breathe out after you you take your oxygen in. It's the gas you breathe out. If it gets too high, it messes up your mentation. It makes you altered. Some people can have normal oxygenation and high CO2s, and they're really sick. We're not really seeing that. That's the weird thing. We're just seeing really low oxygen sats, and then people that lungs sound pretty good and that they're talking and look fine, and you're like, holy crap, why is your oxygen so low? So it's weird. On that front, someone asked me, does transfusions, would they be a possible treatment? No, because we're finding it's not really binding to the hemoglobin. So replacing the hemoglobin is really wouldn't make a big difference. There was some thought for a while that maybe this was like a high altitude type issue, like similar as HAP or high altitude disease. That's also not showing it. So medicines like acetazolamide that we would give for altitude sickness are not really, they're not helpful. A second ago about herd immunity, what my thoughts on it. I do think we will eventually get to herd immunity. There is nothing indicated in this that I think will show us that we're not going to get immune to this if we've been exposed and have enough of an antibody response. You get enough of the population, it will just become a normal endemic disease within the population. For example, H1N1, that was horrible when it went through. I think I was a med student when that went through, and it made a bunch of people really sick. It didn't kill a lot of people, but a lot of people really sick. And now we still see it all the time in the population, but enough people have had it that it's not making mass amounts of people sick like it used to. Okay. Sorry, my husband was saying goodnight. Reactivation thoughts. So this rolls into the whole reactivation discussion. I had brought that up previously. So someone had said that, thought was reactivation is someone showed symptoms, tested negative when they were asymptomatic, and then started showing symptoms again. When we talk about reactivation, the people that are actually testing were no longer symptomatic. They took 2 tests that were negative and they were cleared. And then for whatever reason, they decided to test again, not because they were having symptoms, and they were positive again. And that's what I meant when I said it's not truly reactivation. I think it's just they're still shedding the virus. Let me see if any type of antibiotics work. There was some thought maybe as azithromycin would work because it has like an anti-inflammatory component, but no, it's not really working. Viruses in general do not get treated with with antibiotics, unfortunately, which makes viruses very hard to deal with. Someone asked, if you get a fever and COVID, what are you supposed to do? There's a lot in the news media about should I take Tylenol versus Motrin or Advil. There was this French person study thing that came out that said don't use ibuprofen, it is dangerous. And then the WHO was like, well, we'll look into this. And everybody took that as to mean do not use Motrin. They went back and looked at it. There was absolutely no scientific backing or grounding in why this particular French scientist recommended this. It was anecdotal. And yeah, no, you can use Motrin. If you don't feel comfortable, that's fine. Tylenol is fine. But I will tell you, Motrin is perfectly fine. Advil is perfectly fine. I would use it if I got sick with a fever. Let's see, someone mentioned something. How is my PPE supply right now? Ours is okay. Now, I've talked about this in the past. My hospital does not carry the size of N95s that fit me personally. And so I have my own personal supply and I've been keeping it stocked and I'm doing okay. I'm not into the phase where I have to reuse my gear yet for my N95s. Our hospital is reusing the N95s, but they seem to have an okay handle on supplies. The strategic stockpile got the state of Texas a pretty good amount, and they are keeping most hospitals within a couple week range of being supplied. So right now we're doing okay with it. And as long as we don't have a big bump, we will be okay on our PPE. Now, face shields, I'm using mine over and over again. And that poor thing is getting just destroyed. All right, someone asked, does Motrin work any better than Tylenol for fever? I think it's individualized to the person. For me personally, Motrin works better for me, but I know people where Tylenol works better. So there's no one that is actually better than the other. It's really what works better for you. All right, and then someone asked about correlation between diarrhea and nausea for this. Yes, diarrhea, nausea, vomiting are known symptoms of this disease state. So if you have that, you need to think COVID is a possibility and isolate yourself away from folks, okay? And that was something we didn't realize initially. It's not as common of a symptom. I think it's like 20% of people have those symptoms, but it is a symptom. And a lot of people that I have seen and treated for this disease have had some component of it. So yeah. If you wear a cloth face covering, is that good enough or should you try to filter material? So in a healthcare setting, no, cloth masks are not good. Out and about in the public, yes, they're fine. The idea is if everybody wears a face mask, you're not spreading it to everybody else. So if you are wearing one and someone else, you're fine. That being said, I'm always a bit of the mindset more is better. So if you can add a little filtration into there, that is even better. Just be mindful about how you breathe through it. Some people who have lung issues might feel dizzy or lightheaded because that increased filtration will restrict the flow of oxygen and will make you feel bad. For example, me, I can't wear an N95 for more than 2 or 3 hours in a row, or I get incredibly dizzy and feel awful. So I have to take breaks from that mask because of that. Okay, someone else made a comment here. How long does this actually stay active where you can pass it to others? We don't know. That's the problem. Our speculation on average is about 14 days, but we have seen cases as far out as 21 days. But our best knowledge is 14 days that this is active and you could be asymptomatically shedding it. The most recent studies have shown that you are more likely to shed it in the very beginning before you even know you have it. So you went and visited Uncle Bob and he's an asymptomatic carrier, and in that day or two after you get it, you're not quite feeling off but you're spreading that virus really bad. And on day 3 or 4, you start getting a headache or a dry cough, or your throat just tickles a little bit. You're the biggest vector at that point. You are spreading it everywhere. And then you get a fever, and then you still spreading it. So that is why this is such a hard disease state to kind of clamp down. It's because you're spreading it when you don't realize it. So, okay, is there another type of mask for people with glasses? Yeah, that's hard. Maybe if your mom can buy goggles that seal around her glasses, there's a lot on there that would actually prevent that fogging of the glasses. That is difficult. When I wear a regular surgical mask, which is what I wear when I'm not in suspected patients' rooms, yeah, it fogs my glasses up that I wear at work. It's very frustrating, but you can buy on Amazon those goggles that seal up. I have a pair. And then a lot of them will fit over glasses. That would help. Yeah, and that's a big problem a lot of people been having. The other thing I've seen people do is they'll take on the mask and they'll put a little bit of tape, if you can get the tape for like medical tape, and it'll seal it up at the top so that you don't fog up your glasses. So okay. Someone asked a question, the difference between a DO and MD. This is totally outside of the range for COVID, but they're the same thing. So a medical doctor versus, which is allopathic medicine, and osteopathic doctor, or a DO, they all take the same education. They all go through 4 years of medical school. They go through a residency. The difference is that the DO side has some extra orthopedic manipulation, kind of like chiropractor, that they are taught, and some more holistic type stuff, in addition to all the regular stuff MDs are taught. But in all sense of the word, they're the same in the US. The problem is that DOs are not necessarily recognized worldwide, but and a lot of countries don't recognize it, but they are the same as everybody else. So someone was saying that they've been coughing for a week and tested on Tuesday and it was negative. Yes, we're seeing a lot of falls on these tests. And if you truly think you have it, if you have the stay home until you are symptom free, and at least at a minimum 7, but usually 14 days after your symptoms are done. And then the final question I'm going to go, guys, is a couple of you guys asked, how am I doing? I'm doing okay. I'm tired, but I'm also on nights and homeschooling my kids when I'm off, but I'm doing okay. I am a little frustrated with the healthcare system in general right now. My nurses are being cut left and right because our numbers are down and our staffing ratios verge on being unsafe. Actually, sometimes they are unsafe, and I am terrified that we'll get really sick people rolling in, and that weighs on me very heavily. I like if the frontline healthcare workers are taking a pay cut, all of us are. I am too. And people like our techs who barely make enough money to survive, then the hospital CEO should be taking pay cuts instead of furloughing. They're not being fired, but people are being furloughed or their hours are being cut. If you're a nurse that's PRN, you're just not being given hours. It's frustrating. So on top of being worried about getting this disease, we have to worry about how we're going to pay everything. And I'm doing fine financially. I'm not a doctor that I don't make enough money, but I have family members that don't have jobs right now that I'm trying to help them out financially, and so that is frustrating. From other standpoint, I just try to mentally be okay when I'm home and try to not think about it too much. It's hard because it encompasses so much of my day, and every day there's something new. But I'm doing okay. I physically feel great. And I really think education is so important, and you guys are a strong support system for me, and I really appreciate it. And I find these videos very cathartic and very helpful to me because, there's a lot on my mind, and I feel like the general public doesn't get always the best information given to them. They get sensationalized media information, which is really frustrating. And everyone's politicizing everything, and that just makes me sick. But I'm okay, guys. So yeah, that's it. I'm gonna let you guys go. I have to go get ready for work in about 30 minutes, and it'll be my last night, and hopefully we will not be too busy. Um, and I will, take really care of my patients and go home and have 7 days off to kind of relax with my family. But I'll be back. I'll update you guys later this week. And as always, thanks guys so much for watching. Talk to you later. Bye.